Achalasia is a disorder of the esophagus where the lower esophageal sphincter does not relax properly. Achalasia is pretty rare. It occurs in about 1 in 100,000 people. The Chicago classification was actually developed at Northwestern, and this is a classification scheme that subtypes the different types of motility disorders, including achalasia. There's 3 different types of achalasia, types 1, 2, and 3, as well as other subtypes of motility disorders. Being able to classify these enables an accurate diagnosis, but also treatment management. Alex has a clear diagnosis of achalasia, specifically type 2 achalasia, and his esophagus is relatively straight. He hasn't developed any anatomic deformities, and he's otherwise healthy. So this is perfect for a minimally invasive procedure. The way that this procedure is done is that we're using a standard upper endoscope. An incision is made from the inside of the esophagus. The camera scope is actually inserted in between the layers of the esophagus. The inner layers are dissected to expose the muscle layer. So similarly to the surgical approach, the hilar myotomy, the lower esophageal sphincter and esophageal muscle can be cut to force the sphincter to be open, effectively being able to perform the same type of procedure internally, which was previously done externally. POEM is one of the best examples of innovation in medicine. You can now come to the hospital, get a same-day procedure, and be home in your own bed recovering, which has historically been something that's been done surgically, requiring inpatient stays, and this allows patients to resume their normal life. He's actually doing great. All of his symptoms of dysphagia, difficulty swallowing has resolved, and he's able to swallow normally again. And he was able to really bounce back pretty quickly and get back on with his normal life.